Hello, this is Galit Goldfarb. Thank you very much for joining. Today I'm going to be talking about Hashimoto thyroiditis and natural therapy. Hashimoto thyroiditis is an autoimmune disease that attacks the thyroid tissue through an immune response, through an immune process, often happens intermittently. The disease first appears with a gradual enlargement of the thyroid gland and slow progression of hypothyroidism due to infiltration of immune cells into the thyroid tissue, causing its destruction. Hashimoto is the most common endocrine disorder and cause of hypothyroidism in the Western world. The disease affects between 5 to 10 times more women than men, depending on the country of origin, the country that they are living in. Now, environmental and genetic factors both play essential roles in developing Hashimoto. Of the environmental factors, diet, stress, smoking, and alcohol consumption are the most crucial. In Hashimoto, the thyroid gland tends to lose its ability to store iodine and fails to respond to thyroid-stimulating hormone to produce the thyroid hormone thyroxine, T4, which is partially made with iodine. T4 leads to the production of T3. Both are required to regulate the body's metabolism, including heart rate and digestion and growth. Now, muscle pain, chest pain, and chest stiffness and rheumatoid arthritis occur in about a fourth of people suffering from Hashimoto. Hashimoto thyroiditis is often associated also with type 1 diabetes and other autoimmune disorders such as celiac disease and gastritis. Also, hypothyroidism, thyroiditis, inflammation of the thyroid gland, and hyperthyroidism make people more susceptible to autoimmune disease in general, to other autoimmune diseases. Now, if the swelling of the neck as a result of the growth of the thyroid gland due to Hashimoto becomes a problem because of the pressure it places, then or the way it looks, then thyroid hormone supplementation is recommended. The standard treatment involves daily supplementation with the hormone L-thyroxine or levothyroxine. It is important to supplement properly since excess supplementation with this hormone has dangerous side effects such as hyperthyroidism, leading to heart arrhythmias, especially atrial fibrillation, and as well as osteoporosis. Supplementation, especially if you're over the age of 50, then definitely make sure that you're not over supplementing. Supplementation causes a gradual reduction in the size of the thyroid gland back to its average size after a few weeks or months, depending on your age. However, there is no proof that thyroid hormone supplementation stops the ongoing inflammation of the thyroid gland, like thyroiditis, but antibody levels have been seen to fall after several years of therapy. Unfortunately, no scientific societies have made any dietary recommendations for people with Hashimoto, not only this disease, but for many diseases, but this one as well. They, of course, are highly needed due to the role of thyroid hormones in the regulation of metabolism. The resting metabolic rate in people with Hashimoto decreases with decreasing thyroid function. Therefore, body weight is often goes up. Is increased. Now, the importance of thyroid hormones for metabolism, therefore, major importance, therefore, hormone supplementation is usually the first line of treatment, but diet can certainly support the process by reducing inflammation, reducing oxidative stress and contaminants from animal products and processed foods, and preventing the fluctuation of blood sugar levels and preventing obesity. So let's look into the dietary and lifestyle recommendations. First of all, fiber, very important. Hypothyroidism itself may cause disorders with digestion, leading to constipation. Therefore, you want to consume adequate water and adequate fiber with a minimum of 25 grams of dietary fiber a day. Fiber intake is also very important for a healthy microbiome, and the microbiome is vital for immune health. The state of the microbiome constantly changes and adapts to your eating habits, so you can make major change in your microbiome very, very quickly. Many people with Hashimoto have an unhealthy microbiome due to faulty eating habits and all sorts of different reasons that and other disease states that coexist with Hashimoto. Therefore, you want to make sure, sometimes even these fluctuations of thyroid hormone levels affect the microbiome composition so much that it leads to an increased risk for SIBO, small intestinal bacterial overgrowth, which is I made a video about that as well. You can check, if you have this disorder, you can check my video on that. Also, synthetic sweeteners must be avoided because they affect the microbiome and increase intestinal permeability in people with Hashimoto. To improve the quality of your microbiome, you should reduce processed foods to a minimum. Consume lots of fruits and vegetables, whole grains and legumes at least twice every single day, and aim to lower intake of saturated fats and increase your omega-3 fatty acid intake by consuming walnuts, tofu, flax seeds, chia seeds regularly. You want to also limit your meat and dairy consumption. Increased consumption of animal fat and processed meat in people with Hashimoto leads to progression of the disease. Also, dairy products containing lactose should be avoided because they affect the bioavailability of levothyroxine, the medication, and may lead you to need more of this hormone regularly, which can lead also to problems as well. So lactose intolerance, if you have it, 76% of people with Hashimoto have it. So if you have it, avoid any dairy products, including those with low lactose levels. I would remove dairy products altogether and go for a plant-based diet. Fruits and vegetables that are rich in a plant-based diet reduce the amount of oxidative damage caused by free radicals. That is, these free radicals are produced inside the thyroid gland, and a plant-based diet full of many antioxidant nutrients and vitamins and minerals like iron, calcium, zinc, manganese, selenium, B vitamins, they're all necessary for proper functioning of the immune system and the thyroid gland as well. A plant-based diet is associated with lower risk of Hashimoto thyroiditis and as well a decreased weight. There's very much significance in weight loss for people with Hashimoto. I recommend consuming carbohydrates from whole grains, as these have higher nutritional density and more dietary fiber. Increasing your dietary fiber will help produce a healthy microbiome that has many benefits, as I mentioned, but also prevents unhealthy bowel function, gastric emptying. It will help. So you want to have your microbiome as healthy as possible, and a plant-based diet is the best for it. The legumes, the whole grains, the fruits, vegetables, very good sources of fiber. You also want to remove simple sugars and processed foods. You can read my book, The Gorilla Diet and Lifestyle Program, to help you consume a healthy, balanced, whole food, plant-based diet that supports also a healthy microbiome and a healthy body in general. You want to also avoid gluten. Gluten is associated with autoimmune diseases, including Hashimoto, due to cross reactions between gluten and the thyroid gland, thyroid antigens especially. There's often a coexistence of other autoimmune diseases like celiac disease and gastritis in people with Hashimoto. Testing for celiac disease should be carried out on anybody that has a Hashimoto diagnosis. Gluten-free diet has been shown to reduce the level of antibodies directed to thyroid peroxidase and thyroglobulin, also increasing the function of the thyroid gland. Although there is no recommendation for gluten elimination in Hashimoto dietary therapy, I do recommend a gluten-free diet for people with Hashimoto, but really I would check if you have coexistence with gastritis or, of course, celiac disease, then of course you want to avoid gluten. Gluten-free diet may be potentially harmful if you do not suffer from these other autoimmune diseases, because it just may lead to nutrient deficiencies. It also may lead to increased heart disease because you won't be consuming sufficient fiber, and especially if it's done improperly. So if you do not have a problem with gluten, then you don't need to avoid it. Just make sure that all the grains you are consuming, the wheat you are consuming, is whole grain and preferably organic. Other allergies that exist are also associated with Hashimoto thyroiditis. Therefore, eliminating food allergens from the diet is essential for your health. Iodine intake also influences the incidence of Hashimoto, hypothyroidism, and hypothyroidism. Chronic exposure to excess iodine intake leads to the disease, partly because high levels of iodine in the thyroid gland make it have a stronger immune response. For this reason, I do not recommend iodized salts and instead recommend consuming seaweed once a week if you are vegan. If you are not, then you do not need any iodized salt. You would be getting it probably sufficient amounts from fish and other foods that you are consuming. Eggs. Selenium is essential to thyroid function as well. The thyroid gland has the most selenium in it of all tissues. Thyroid peroxidase, the enzyme produced by the thyroid gland that with iodine creates the hormones T3 and T4, and also the potent antioxidant enzyme glutathione peroxidase, and the whole group of enzymes have selenium in them. And they are essential for thyroid function since they protect the thyroid gland from excessive free radical damage. That hydrogen peroxide is produced during the insertion of iodine when thyroid hormones are produced. A low selenium intake of below 40 micrograms a day is very much a risk factor for Hashimoto. So you want to consume, the best way to consume it is selenomethionine, 200 micrograms a day. This has been proven through many studies to reduce thyroid peroxidase antibody concentrations. Also, perhaps if you find a supplement with myo-inositol and selenomethionine in it, then that is preferable. This combination of both of these together has been shown to decrease thyroid stimulating hormone, thyroid peroxidase antibodies, and thyroglobulin antibodies, and it enhances well-being as well. Sometimes even restoring normal thyroid function in people with Hashimoto. So sufficient selenium intake is vital, but you should also check where, if the location where you come from may have selenium contamination in the soil, and then you would have excess selenium. You do not want to supplement in that case. You want to supplement if you have a deficiency in selenium and if the area where you live does not have any selenium contamination. About 50 micrograms per day of selenium is great. Selenium, if you do not want to supplement, which is really best, then consuming Brazil nuts, green peas, beans, broccoli, and potatoes on a regular basis is absolutely perfect. Also iron. People with Hashimoto are often iron deficient due to the coexisting autoimmune diseases like gastritis and celiac disease that impair iron absorption. Iron status should be checked in everyone with Hashimoto, especially menstruating women, since iron deficiency impairs thyroid function. Although iron deficiency does not result from Hashimoto, it is often present. Definitely, iron deficiency blocks the activity of thyroid peroxidase. As a result, there is a reduction in the production of thyroid hormones. You definitely want to make sure that you have sufficient iron levels. Supplementation of anemic women with impaired thyroid function with iron improves thyroid hormone levels and the functioning of the thyroid gland. Iron is found either through supplementation. You can take it about 3 times a week, and it should be enough, 25 milligrams, or of iron bisglycinate, which is easily digested and doesn't cause constipation. Iron is also found in bitter chocolate, green leafy vegetables, sesame, and pumpkin seeds. Also vitamin D levels. Many people with Hashimoto have been found to be vitamin D deficient, with an inverse relationship of vitamin D levels and thyroid peroxidase antibodies. So vitamin D levels below 30 nanograms per milliliter definitely is too low. I suggest supplementing with 1,000 international units of vitamin D during the winter months, and if you have a deficiency, you can even go for 2,000 international units of vitamin D a day, or at least 5 times a week. Check out my video on vitamin D supplementation for best advice. Also, zinc levels are lower in people with autoimmune diseases, including Hashimoto. So I would recommend supplementing with zinc sulfate about four times a week. You also want to stop smoking and drinking alcohol. Smoking and drinking highly increase oxidative stress, leading to the progression of Hashimoto thyroiditis. Although the consumption of fruit and vegetables on a plant-based diet rich in antioxidants reduces the amount of oxidative damage, it is still best to reduce free radical damage by ingesting fewer toxins. So I hope you found this video helpful. If you did, please give it a thumbs up. Please also subscribe to the channel, to my channel, if you like anything to help you heal any disorder that you may have through diet, nutrition, and supplementation, natural lifestyle. And also please visit my website, thegorilladiet.com, to help you lose weight and achieve maximum health and wellness. Thank you very much for joining.